Hello everyone, this is Dr. Sravanthi Reddy, Fertility Specialist and Gynaecologist at Shubha Fertility, LB Nagar. Very commonly asked doubt among young couples who have delivered recently, that can they have intercourse post-delivery. So firstly, we have to understand the lady has delivered and given birth to a newborn child. So she's flooded with so many responsibilities of the child, like diaper changing, lactation, and the sleep cycle is disturbed. It is very stressful for the mother. It is adjusting to the postpartum is a very big deal for the mother, and after that, even post delivery, there is the recovery time for the uterus. So what happens to the uterus is it has to come back to its normal shape. It won't go back to the pre-pregnant uterus, but it has to come to a normal size, where it is called as involution of the uterus. So that might take some time. And coming to the vaginal discharge post delivery, it will take around 3 to 4 weeks. Vaginal discharge will be continuous till 21 days to 1 month. So at the time of vaginal discharge, which is very common after delivery, so at the time of vaginal discharge, if you participate in intercourse, there are chances of infection and there are chances of involution of the uterus. That means uterus which has to get involuted properly, it might lead to subinvolution. And next thing is the wound healing process. Even if you've delivered through normal delivery or cesarean section, see, normal delivery there sometimes will give an episiotomy wound, which means we'll cut through the vaginal wall to deliver the head of the baby, deliver it, to create a space for the delivery of the head. So that wound might take time for the healing. It might take around sometimes 4 to 6 weeks. And coming to the C-section wound, it might take around 6 to 8 weeks, the healing. So all this process, adjusting to the baby, the new mother, and the vaginal discharge, even the wound healing, everything takes time. So around 6 to 8 weeks. So this postpartum period is very important for the mother and for the baby. So it is always better to wait 6 to 8 weeks. After 2 months you can have intercourse, there is no problem. But only thing you have to keep in mind is use a contraceptive. Better to use a barrier contraception. If you want to use any other contraceptive method, it's better to consult your obstetrician and decide on what contraceptive to go ahead. People have a misconception that if the mother is giving lactation, there are no chance of getting pregnant. It is not like that always. You might have ovulation despite not having periods. You might ovulate and there is a chance of fertilization and thereby pregnancy. So it is always better to consult an obstetrician to discuss a correct contraceptive method. Just go about, you can have participate in sex post 2 months of your delivery. Thank you. If this video is informative, follow for more content. Thank you.